like totally delayed and stick figurey right now as it is, so it's sort of weird.
I have never been in my life referred to as a stick figure.
You know what? Only one of us can record. So you got the recording then, okay? Diego?
Okay, got it.
Yeah. And it's going. Yeah, when I clicked on it, it only gave me an option to stop it, and so I definitely don't want to do that. And I think that your computer's probably functioning better right now. So I appreciate you taking that. And hopefully we'll see some people soon.
You know, great. I don't know how, but these days are getting along with.
The summer days, they got that way.
Well, and I get so bad when I have vacation coming up. But just like, let me go.
Yep, counting the minutes.
I should just take that Monday off too. That's the only thing I've done that. You didn't try to figure out how you before time off. It's so long.
Hi, Haley.
Hi.
No response yet from the DPS folks, so we'll give it a little bit longer.
I wonder if they haven't started working on their reports, so they just don't have a response. I'm not, but then that also seems like that would be an easy response to give. So I don't know.
How you doing, Haley?
Good. Busy, but
Hello.
good.
Yeah, I just had to work around this thing, threw a deal at me at Teams, making it difficult to sign on again, but finally it worked.
Oh, well, welcome, Alan.
Good afternoon to everybody.
Good afternoon, Eileen.
So team, I just realized I had forgotten that when I joined, because my Zoom is set for that, it mutes me when I join. And I recognize that I heard someone say like, hi, Eileen, and I'm assuming I'm muted. So I'm like, but I actually am not muted. So hi.
I saw the wave. So I'm like, oh, okay.
Obviously, I'm feeling a little bit foolish, and that is okay.
It's the nature of these meetings.
It is, isn't
Like
it?
The phrase we all know, you're muted.
Yeah, absolutely. Absolutely. Yeah. So team, I've got that we're 2 minutes after the hour, and I don't know that I know that I haven't been a stickler for quorum. I wonder if even we certainly have a fair number of people here. Is that okay if we get started we'll do our introductions before we head into the agenda? Thank you for people nodding your heads. And for people who aren't able to turn on their camera, this is Eileen Barrett. And I'm going to ask everybody, I'll call on you in the order in which I see you, if you would let us know your name, the pronouns you prefer, and also, I feel like, gosh, we've covered a lot of ground, but it's fertile ground to always come back to, which is red or green. Okay. All right. Andrea.
Good morning, good afternoon, everybody. Gosh, this morning. Andrew Sundberg, I'm the newly hired deputy director, but acting director as well for the Center for Medical Cannabis. I'm a green girl, green all day long.
Excellent. Hallie.
Sorry, I didn't hear what the second question was. You said,
Oh, pronouns. Pronouns and red or green.
red or green. Okay, so for chili. So I'm Hallie Faust, and I don't know if it's red or green. It just depends on the heat and the taste of the day.
Fair enough. Fair enough. Rosanna?
Hi, Rosanna Artsmith. I'm the manager of patient services here at the Center for Medical Cannabis, and I prefer Christmas.
If we had a lot more time, I would describe how recently seeing Trevor Noah and someone from the audience asked him when he was performing at Cyndia, his stand-up, that he was asked red or green and how the crowd went wild and his confusion about what we were talking about. But I won't. If you have a moment, you might absolutely think that was as much of a hoot as I did if you look at that one on Google. But we'll come back to that. Eleni.
Hi everyone, I'm Eleni Bukovalis, she, her pronouns. Both are good. Red, I guess, but both are good.
Wonderful. Diego?
Hi, I'm Diego. I'm the health educator here with the Center for Medical Cannabis, and I'm gonna pick both. It's hard to just choose which is better, but I'd say both.
Okay. So I noticed you said both without mentioning a holiday. I totally get it. I know that there's probably a lot going on there. Haley.
Hi everyone, Haley Peterson, part of the substance use epidemiology section here at DOH, she, her pronouns, and both are good, but red is my preference.
Excellent. Gary?
I'm Gary French. I'm the medical director here at the Center for Medical Cannabis. I'm looking this way because my computers are getting reconfigured as we speak, so I am paying attention. I do Christmas because I can never make up my mind, and that way, and plus, some places the green is super hot or it's super mild, and vice versa with the red. So getting Christmas is just the safest, easiest way to go. You can always, scrape one on off of the whatever you're having and have the one that's most palatable. But yeah, recently I used to be green, but recently it's been very, very hot, and so I do Christmas.
Nice. I like it. I
Yeah.
like the intentionality too. That's awesome. Alan.
Alan Plymell and Deming. I still work my 2 days a week. I am definitely addicted to green chili, but I occasionally like a bite of red.
Always a good call. And Katie, I saw, I think everybody probably got to see that it's really storming where she is, and so she's not sharing video. We all hope that you stay safe. I don't know if you're able to unmute yourself to answer the question.
I'm gonna try. You all are coming in and out, but hopefully you can hear me. So Katie Wikowitz, I'm at University of New Mexico, she, her pronouns. And I'm similar to Gary. It kind of depends on the place, but I often go with Christmas because sometimes I like the red better than the green and sometimes green better than red.
Fantastic. Thanks, everybody. I appreciate it. I'm Eileen, and I actually, I thought I was always green, and then I just ended up the last year, I've really been drawn to red, but I'll probably swing back. It's probably a pendulum or something. Anyway, thank you everybody for going with it. And of course, I think that this crowd also knows we do that to build community. We also make sure to the extent that we can get to know each other. And then pronouns is because it makes for safe for people who are non-binary. And it helps us all just have better communication when we know a little bit more about each other. So with that, and also one of the people you'll see who's not on the call, who has previously been on the committee, is Crystal Apodaca. She did give her notice for reasons related to bandwidth and otherwise. So I know that we're all grateful to her. If you are offline in touch with her, please feel welcome to send her a thank you. I will also ask if you would consider looking up and waving so I can do a screenshot and send it to her to tell her thanks. Is that okay? Count of 3. 1, 2, 3. Thank you for going with it. Okay, so with that then, I appreciate you. I'll send that to her. is that I'm going to mute myself, including from my barky puppy, so that we can next hear from Gary. I know that you probably saw he sent the agenda. There also is the agenda that I just added to the chat. And Andrea, you're in good company. I think I probably forgot to say she, her, hers from myself also. I will mute myself.
All right. Well, thank you, and thanks for that update about Crystal. Yeah, Crystal, she was remorseful, and if she can come back at some point in time, she will. But she had enjoyed working with everybody and really did enjoy her time. And I think we understand. I think that we have a wonderful group of people that participate on this committee, and oftentimes can overextend themselves. And I think that is inherent with wonderful advocates, right? So yeah, she was great, and we wish her the best, and we'll see what happens. The other announcement or update I wanted to make was with regards to the CPPC survey. So we did have another one. I did send that out. And the reason I'm bringing that up today is that some of the data that we have for the annual report, we can get it from there. We can take it from CPPC if we need to. If we can't find it in other literature, it's there, and perhaps even if it might not tackle the theme that we're addressing in the written portion of the document, having something there that is New Mexico true or New Mexico driven data, I think is helpful, having a little graphic with each section. And so you might notice that in some of them, I did do cut and paste of some of the graphs from CPPC that might work in those sections. And might not. Again, these are pretty specific to the questions they were asking in the survey, but just keep that in the back of your head with regards to maybe working it in. I thought that the designated driver one, and we can talk about these perhaps a little bit later as we talk about the annual report, but there was one about designated drivers and how often the patients versus those using recreationally might ask for a designated driver. That could be something that we could insert under road safety, even though it might not be tackling the issues that we are discussing in road safety. So if you do glance through that, just sort of keep an eye with regards to what might translate visually into some of the groupings. And so if you want me to, and that can be found on the SharePoint site under the survey section, but also it is on our webpage for the Center for Medical Cannabis if you can't find it in the one site or you're having issues connecting with the SharePoint site. But please take a look, and I think we'll get into it a little bit more later with regards to this was, again, a questionnaire that asked a lot about substitution of utilizing cannabis as a substitute. And just, again, and I think Eileen and I talked about this a little bit earlier, in no way are we suggesting that they do that, In fact, we always want patients to, if they were to attempt such a feat, is to definitely do it with the oversight of their medical provider. And I think that, that perhaps could be something that we add into that, or that we really stress if we choose to use that bit of data in the report for like the number 8, I think it might lend itself there. But that being said, I'll go ahead and turn the time back to you, Eileen. I think that, or rather, Alan. Alan's got a presentation for us, Cannabis in the Workplace. And Alan, did you want me to go ahead and share my screen?
Yes, if you would, please. My internet was down just a minute ago and I finally got it restarted, but we're ready to go.
And can everybody see the title slide?
Yes.
Great.
Okay, and just an omission, I have nothing to declare, so I will get started here. And the presentation is about cannabis in the workplace and the safety on the job and productivity, which has become quite a big issue. Next slide, please. With the legalization of marijuana either medical or recreational. And of course, we need to consider what it's doing, impacting the safety on the job, and whether a patient can be using it on the job or away from the job. There are a lot of difficulties of telling whether they're impaired. And so impairment may just be a lack of coordination, maybe sensory deprivation, things like that, and what it is, how it's affecting the employer and their bottom line too. So with that, the THC in the marijuana, we need to consider, next slide, please, how it affects the body, reaction time, coordination of motor skills, etc. And according to the national study, employees who tested positive had 55% more industrial accidents, 85% more injuries, and 75% greater absenteeism compared to those who were negative. And so there you go with decreasing productivity, absenteeism, high turnover, lawsuits, injuries that cause workman's comp. Next slide. The studies have shown how employees are 3 times less likely to produce a positive test if they know they're going to be tested. But an expanded testing panel that checks for the more common misused prescription drugs would probably be also a better choice than strictly doing for cannabis. As with, from the perspective of the employer, they should make sure that their management teams are well trained, know their issues, know their rules to help enforce the policies. And as far as impaired employees or employees with a tendency to be impaired, they should know what resources they have to help them, to rehab them, and if they have an accident, injury, what is the policy on testing post-accident wise? And if somebody, say like in New Mexico, there are lots of DWI problems with alcohol and arrests and convictions, things like this. How do you handle the employees without stepping over the line and become a litigation problem? So the next slide. Probably the numbers are not exactly up to date, but the sources at this point had said since 1912, 24 states and Washington, D.C. have legalized possession and sale small quantities. So more people are using it, using a lot more. And workplace injuries for the age group 20 to 34 have shown to be greatly increased, as demonstrated by the effects on the worker, impairing them for their job duties. However, some of the people that may be using it for pain may perform better and have less impairment because of the decrease in their pain threshold. Next. And I've got some data showing up pretty soon here. And this was talking about how this table was set up. And Bureau of Labor Statistics studied from 2006 to 2020. 13 states have adopted the recreational marijuana, and 10 states permitted the recreational sales. So they show a sample 632 state year observations with information on age-specific workplace injuries. Outcomes were natural log workplace injuries per 100 full-time equivalent workers and per 100 persons. Institutional board approval was not required because the use of secondary and de-identified data. Next. So they applied the differences in difference multivariate regression framework. And came up with the estimate that about 10% of the people, 10% greater in injuries and incidents next in the workplace on the people who have used recreational versus non-users. And one of the odd things is and that was that age of 20 to 34, but they found also that some of the older employees had fewer injuries, and whether it's because they were more mature, used less. Next one. This the next slide gives the results, and then we can go on to the table to see. Really need to read the results to understand the table, but that just shows picture-wise the results on that. Statistically significant increase of 12.9% injuries to per 100 full-time workers. And for adjustment to covarieties, the increase was 9.6. So so basically overall approximately 10% of increase in injuries, and all because of the use of recreational THC. And the next slide, please. Oops. Gets thrown out. Somehow I got thrown out there for a second.
Can still hear you.
And we can still see the screen. Glad that we still have you.
Oh, okay. So I guess we'll go on to the next slide. They're talking about states who have passed laws to help define the issues on here, saying that they're trying to define safety sensitive exceptions to the laws, which prohibit discrimination based on off duty marijuana use. And several states have different laws related. New Mexico simply defines safety sensitive position as a position in which performance by a person under influence of drugs or alcohol would constitute an immediate or direct threat of injury or death to that person or another. And don't worry about the other states. And then we have a couple of slides that show the next one or two show the other states. These will be recorded so they can be looked at later at your leisure. But one example is Washington cites some of the safety sensitive positions such as police, operation of motor vehicles, heavy or dangerous equipment, regular infrequent activity on job sites, work on power line or gas lines, hazardous material handling, and taking care of patients and distributing their medications. I think all those could be thrown in there. The last slide, I think, please. So one of our problems will be having the state determine what specifically they want to set standards on safety sensitive positions, and whether they will allow people with medical cards or to be using during work times or close to work times, or whether recreational use will affect workplace. Say, for example, a time frame between the use of it and going back. Some like airline pilots have to have so many hours from the last time they've had a drink before they can fly. And the last remarks I have are about testing. I didn't put any slides in here on this because there's such a wide variety of things going on here. Some states will call 2.2 nanograms of THC as impaired. Other states will show 0.5. There's no way really to tell because each person has a unique metabolism. People who are naive to THC will probably have easier impairment, where people who are seasoned heavy users may be able to use a lot without showing impairment. So a number of things need to be studied more research, more studies going on. We have no standards that can be set and adopted by everybody like we do with alcohol at 0.05% being impaired. So that's kind of my viewpoint in a nutshell.
All right, great. And I think I'd just like to segue right now into This, of course, is our SharePoint site. And down here, if we go to our schedule, and thank you, Alan, yes. Thank you for that presentation. And again, a lot of what Alan was talking about is here in the road place safety and the workplace safety. And we'll get to that here shortly. But I think the annual report is always something that we want to take an inventory of, or at least check with it and see where we're at with regards to our progress and some of our dates here. And I do know that last time we did spend quite a bit of time on child access. And I did see that, Eleni, you had gone back in and put in the references there at the bottom of each section, and I think that the graphs are all there. I think, I put here just discuss on 716 with regards to Eileen and Hallie. Have you had the opportunity to dive into child access yet, or are in the midst of doing so? And what are your thoughts there? We can go to the document itself and take a peek. In fact, that might be a good thing to do.
Say, Gary, before we move on, can I just ask a couple of questions of Alan related to this? So, Alan, is this article that you mostly are citing, is that in our Zotero now? Because wasn't sure which one under workplace safety it might be.
It's actually part of the presentation here, and it is in the references. So if this is workplace safety,
yeah,
and it's this article down here. It is let's see which one it is. It's going to be number 14. So that was, recreational marijuana legislation and workplace injuries among younger workers. And so that's where that data comes, and that is quite an interesting juxtaposition between the younger individuals having a 10% increase, yet older workers not. And as researchers theorize that the younger workers' cannabis use may diminish their cognitive function, leading to increased injuries, whereas in older workers, again, as Alan mentioned, better pain control was perhaps a better substitute for more intoxicating substances, and therefore that led to fewer injuries in the elderly. And that was just such an interesting thing. It'd be great to have perhaps some New Mexico data that also showed that. But again, that was from 2006 to 2020, Bureau of Statistics for those, 600 different sort of cataloged events. So pretty interesting data there. And that resource is here, Hallie, down number 14.
Okay, it's not in Zotero though. I can look it up separately. It's fine. I'll pick it up, and when I pop it in there, because it would be interesting to read the whole article. I'd like to see it. Thank you.
Let me. I would just cut and paste that into your search engine, and that might be the easiest way.
I'll find it. It's not a problem. I just want to know if I missed it. I appreciated this. Thanks, Alan. And I had just two quick questions on it. Does, without looking at the article yet, does it take into account job position, or is it simply by age, sort of in a simpler method? Because we know as people age, they get into higher positions and probably more out of safety sensitive positions in some way.
There's a lot of controversy about what are safety sensitive positions. I found one article that one company put everybody on their full employee base as all safety sensitive positions, even their clerical workers and maintenance staff, everybody, and created a lot of fuss, but there was nothing in their laws that prevented them from doing this.
Okay, so that was not a factor that was necessarily adjusted for per se?
I believe that it's kind of complex in that one explaining the graph and all. I think it takes some of those questions out by explaining the groups that they did in comparisons of non-user users, age group, and so it's pretty complex in there that way, but I think they did adjust for some of those factors.
Okay, thanks. Well, I'll go back and look at the article. I have a broader question related to one of the items that you cited in one of your conclusions, and that you asked about firearms. And I'm wondering, for example, it's illegal for somebody with a concealed carry permit to go in to be drinking with it in a public establishment, or to go into public establishments that have I don't know what the ratio is, like 60% of the revenue from alcohol sales versus if you're under that, I guess you can go in. Law enforcement officers can go into liquor or drinking establishments and drink anyhow. Do we have any laws on the books about drug use and concealed carry or other firearms issues? I'm just wondering.
Well, one of the things, if you take a hunter, I mean, not a hunter safety, but a concealed carry class, they state there are definite rules in there of whether you can carry into liquor establishments or what level of liquor establishments, and you cannot carry into government buildings or government properties.
Right. So I'm wondering if we have similar types of laws or concerns with cannabis stores or cannabis use.
So I can tell you that the laws do state they cannot bring weapons. I believe Cannabis Regulation Act does not allow weapons. But there are no specific laws, and there's no specific law that in the state of New Mexico that if you are using cannabis or enrolled in cannabis program, you can't have weapons. However, on the federal form you have to fill out, one of the questions on there is, are you currently enrolled in a medical cannabis program or using cannabis? And if you say yes, you cannot purchase a weapon or get carry concealed carry. So that's
Right.
on a federal form. Yeah.
If you already have a weapon, that doesn't do any good, of course. And you're saying are there any laws that prohibit going into dispensaries with firearms?
I believe there is, I'd have to double check, but I know in one of the versions of the Cannabis Regulation Act, they did say no weapons or violence.
Because
I don't know.
It's a fourth degree misdemeanor, fourth degree felony if you go in to the wrong place with alcohol. And I'm wondering if we should consider this as one of the questions or one of the suggestions or bring it up in some form. Even though we may not have any real data on it, and I don't know how much data was available for alcohol per se at the time either.
I believe that would be a good consideration, Hallie, yes.
And I think that does sort of segue into something, again, Eileen and I were talking about with regards to these sections. And let's just use this one as the example here. So this is the workplace safety, and I probably should put it up here, but if you follow the work SharePoint, this is the workplace safety document. And I do invite you all to read, and as you know, Hallie and Eileen have like comments here. We can sort of go through these and address these, but another section here is the discussion section. And then also, Eileen and I talk about that is that to direct our discussion and how to summarize the section itself, maybe conceive or think of what an ask would be. What is something the legislature could do to address the concerns brought up by this section of the annual report? And so in hearing you two, Alan and Hallie, a potential ask here would be, address gun use and at dispensaries, or at least address it, and if it doesn't necessarily become a theme this year, there's no reason why it couldn't be one at a later time. So perfect. And so I think that all of us, as we read these sections, things are going to come to us that we feel need to be addressed in New Mexico or would be important for our fellow New Mexicans to understand. And so I think just putting that there sort of as an ask, and then we can do maybe a survey monkey. Eileen, I thought this would be a good idea later on to see what one or two things per section really need to be fleshed out maybe, or suggested, or what might be better to put on for another year. And so as you read through these, perhaps consider putting some of those suggestions down, those things that you feel strongly about. But since we are on workplace safety and we've had this wonderful presentation, I feel we can just, as a group and a committee, sort of address some of the comments that Eileen and Hallie had raised. And so, for example, right here, I'm going to go ahead and share this section. This is talking again about testing, and Alan hit upon this in his presentation. The testing for drug impairment due to THC through biological samples is problematic due to the limitations of drug detecting technology and the lack of agreed upon limit to determine impairment. Currently, there is no standardized insufficient concentration that can accurately predict impairment. And I like how that's worded too, Eileen. And I think that if the legislature simply got those four lines, and that's all they understood from this section, I think that would be a success. Because even with the last legislative session, there was a bill to, they wanted to use a biological sample to determine impairment. So, and the goal was they wanted to have people to be able to use outside of the workplace. And was there some magical level that if they tested below it, then they were safe and you couldn't charge them with, being impaired. And it really took some effort to make, in the initial analysis, to make sure that the point got across that you cannot use what we currently have as far as sampling to measure impairment. And so I think that is a theme that definitely, could be highlighted in the summary or in the discussion at the end, the thread tying this all together. I totally agree that prescription is the wrong word to use here, Eileen. I think that recommendation, or we could just say medical cannabis card, would be a more appropriate. I think this got lifted from the 406, but I agree that prescription is not the appropriate term here because we don't actually prescribe cannabis. So is there a different word that others would prefer to incorporate here?
The prescription may come into play after they
Reschedule.
reschedule, yes.
How about we just put medical cannabis card for right now?
So it's also true, just to clarify, for recreational or not?
There's a bit of here's what some employers do. If the individual has a medical cannabis card, they view it as a prescription, and that individual is allowed to utilize, of course they wouldn't want to show up to work impaired, but they're able to utilize the cannabis and therefore have a test positive for it if it came to testing. I do not believe that recreational cannabis users have that type of workplace guarantee or workplace safety. And I'll share the example with you is that there was a gentleman, he was a substitute teacher. He wasn't full-time, he was simply a substitute, and he would use recreationally. But when it came time for him to become hired as a teacher by the state, if he was going to continue to use, he needed to get his medical cannabis card to show that it was being used for a medical purpose and reason. So in that instance, there was a difference there between the individual that had the medical cannabis card. The employer determined that was sufficient to enable them to utilize cannabis outside of the workplace. But if they didn't have that, then I think that in that instance, they had more of a zero tolerance policy. So, and again, it's going to be employer specific. And Andre, you can, chime in here if I'm misquoting, but it's really going to be up to the employer what they determine. And again, there's not that uniformity in guiding employers in our state about what, they definitely have to follow or not follow. It really is sort of up to the individual employer. And then also, if you throw any type of federal connections in there, they might have a much more austere policy simply because of that. So, but I think that as a whole, impairment on the workplace, is going to have to be not left up to a biological sample, but the employer or those on site are going to have to perhaps understand and learn how to recognize the signs of impairment in somebody where they could be putting others at risk. And that again could be one of those common themes or threads that we discuss in the discussion part is, is there uniformity training amongst employers to help them understand impairment? And how might that also work in a school district, with teachers being able to interpret impairment in youngsters as well? So I'm not sure, is this...
Carrie, I just put in the chat the section from the Cannabis Regulation Act related to employer protections. So there's some very specific language in there about.
And we might want to drag that into this and put that in here for clarification of that, Hallie.
May I make a suggestion?
Yeah.
This is amazing, and this is incredible. And Alan, I think that the work that you did and the way you presented it to us and what you wrote up is remarkable. I sincerely hope that you consider also either writing an op-ed and submitting it to a paper, or also in another sort of medical outlet, because I think that was tremendous. Team, I'm hearing that we have a lot of people with a lot of knowledge here, and that we are a little bit time pressured because we have 45 minutes and we have 8 dimensions to review. May I suggest that, or I want to hear how it lands, that when we, the consideration, and Gary, this includes, I really would like to hear if this meets your needs as well, but really the committee, is if we can know that we are not going to be able to finish discussing all the detail for each of the 8 dimensions, but that what we can do is prioritize adding what you were thinking might be one of our asks. And one could even add that to the chat, and we don't have to have the details about, say, for example, if we get to, we got to consumer and product safety, maybe we don't have to know at this time all of the details about the existing laws. We can just say in general, and we can always remove that information. We can always remove that recommendation later when we have, or we can refine that recommendation or that ask later when we have a different information that is available to us. Does that make a bit of sense? Like right now, it's almost like a little bit of like a like information sharing and then brainstorming, less than going in depth into each of them, just for our time, because we have, I think, knowing that I just took 2 minutes of our precious time, but we have, if we took the entire rest of the meeting to discuss, we have 5 minutes per dimension that we have to report on. Did that make sense, that ask first? Okay, does that sound like I saw a couple of people nod their heads. Does that sound like a reasonable way to move forward? Okay, thank you.
In addition, on what your idea here is, Eileen, the cannabis in the workplace and cannabis related with driver safety could be kind of merged together, because the issues, safety and everything, and impairment, it applies virtually across the board with the two.
Yeah, it's a good point, Alan. And I think one of my notes after reading through whatever we have so far was, do we want an introductory section that talks about the commonality problems of the various sections, and then they don't have to be repeated in each section. They can just be referred to up above.
Yeah, and that's what this section here is just, as people get ideas, just like that, Hallie, an introduction. And so I had just put stuff about the rescheduling there, could also be perhaps an introductory hook for the legislators. But Eileen, to your point, do you want to just maybe go to child access? We got the document here, and I think we all saw this wonderful work last time, and then just going down to the bottom right after, asks, and so does anybody have a couple of suggestions about what they would want the legislators to take home after reading this section or implementing? Eleni, you were probably most involved.
So I think one of the things that really struck me, sort of writing this and going through the data was accidental exposures in children, and that primarily relating to edibles and some of the packaging issues surrounding that. Which sort of overlaps a lot into consumer and product safety too. And so in my mind, that's something I'm thinking about is where is this balance between, it's between maintaining a legal market where advertising and marketing are competitive versus protecting children from these accidental exposures. And there certainly are things that other states are doing to make packaging a little bit less appealing to children. It seems like the edibles are something that are sort of the highest exposure in the children. I also think that potency is something to consider across, again, child access and consumer and product safety, because the increased potency of the edibles too is, I think, an issue in unintentional poisonings, both in children and, we haven't talked about this much, but I think potentially in geriatric patients as well. There was, and Katie, I'm sure you're looking at this, but like there was a spike in the older population, I noticed, for poison center calls as well. And I think that's what comes up immediately for me, just kind of thinking about our points on that section. We don't have a lot of data from a pregnancy standpoint, but I think, like in terms of New Mexico data, but I do think it's very, very clear that pregnant women should not be using cannabis. And I think that that messaging is sort of consistent across the board. I think maybe areas designated as rural and younger pregnant people may be more at risk. Hallie, Eileen, I don't know what your thoughts were after reading.
Yeah, well, I think there's more and more evidence, right, in pregnancy. So there are a couple of articles that I've put into the Sotera that we've seen over the last 6 months or so. And I like the idea of maybe expanding the category by itself instead of just child and infant safety, but to include pregnancy in some form. Now, it's not in the statute, but I'm not sure we have to use the exact language of the statute on the title of the section. But I think you've done a great job here, Eleni, and all my comments were on your prior draft. I didn't reread this draft because I was trying to read the others for this time, but yeah.
All I did was add the references. It's not substantially different.
And again, this is accessible to all of you. And so this is just sort of the tip of the iceberg with regards to potential asks. And so I think, Eileen, would you agree? And everyone, put a couple down, and we can then sort of survey and come to a consensus about what the most important 2 or 3 per topic that we want to really address are. And I think that understanding can frame perhaps some of the editing that Eileen and Hallie might be doing, and tying it together. So, do we want to move on to the next one, or you want to keep working at this one, Eileen?
So I think you're being an amazing taskmaster, and I think moving forward, team, if you're unsure how you can access this, I'll add it again to the chat, but above I had included the SharePoint link, and we'll add it again so you can do that and you can add your comments. You might be able to see if you log on right now that even while Gary was taking notes, I was writing some suggestions as well. And when you do get to look, you will be as impressed as I am by the work that our colleagues have done. So we'll turn it over to Gary to move us forward.
So here is workplace safety, and here is the workplace safety document. And I'm responsible for this quote here, and I actually don't think it should be in the report, but I think that it does. This is messaging that Libby got when she went to that DOT Cannabis Day. That really there's a lackadaisical attitude about really addressing the cannabis. Here, this was the deputy chief, I think, in Albuquerque. He said, if I had to make a decision that an officer spend 1 hour on a simple marijuana case and preparing the paperwork and writing the report and tagging it into evidence, or 1 hour walking down the business district introducing themselves to business owners, I'll take the second option every time. I think it sort of sets up, sort of the new approach after the Cannabis Regulation Act, where our officers, the smell of cannabis cannot be used as a means to determine a search of somebody's vehicle. That is actually off limits. And so I do feel that sometimes they might feel a little hamstrung in the way they approach this. But I simply share that there, and I really don't think that we want to be pointing any type of fingers. So I'm actually just going to remove it right now. But again, have that sort of maybe in the back of your head with regards to how our safety officers might be approaching this. But here is all the information about road safety, talking about New Mexico, where we typically rank, and then a lot of the issues with testing and how it's just really, really rather difficult. Here's the 2 nanogram and the 5 nanogram that Alan had mentioned before, how those are constructs used by some states, but they're constantly challenged because, again, that it's no measure of impairment. And so what is the legal, purpose for that? And then again, there are some states that are using oral swabs now, but again, those are testing the presence, yes or no, but not really testing the quantity. And so again, not really a true measure of impairment. But interestingly, and this is going on in, I think, Louisiana and Alabama, they're using the oral swab in, there it is, Alabama, and then combining that with, what the individual was doing, that with the DRE. And actually what they're doing is to get it admissible, they're really have to addressing it through legal means. That really the law has to enable oral swabs with DRE to be admissible. We can't just assume that they would be. And so states are really having an issue finding this all out. But here at the end is the DRE. We talk about this, the drug recognition expert training, where individuals and our officers receive training with regards to how to identify like a cannabis impairment versus an opioid impairment, alcohol impairment. I think they hyper-focus more on those than they really do on the cannabis because the impairment symptoms are different. But again, perhaps an ask for this section would be more monies for DRE training. I think there's an apropos comment here. There is that evidence that roadside tests taught in DRE trainings to detect cannabis are sensitive. However, they do take a lot of time to get certified, but it still could be more economical because the testing, the money spent for doing roadside testing of bloods and et cetera is extremely expensive. So perhaps DRE is a way to go. And again, one thing is I did review the Cannabis Regulation Act. And DPS is supposed to be collecting this data and putting it on their website. I have yet to find it. In fact, I did request some records from DOT. All I can say is that they can research cannabis-related crashes, but only fatalities, and then only if the testing was done. And I think that that sort of meshes with what Haley, with what you had heard too. This was an update from that same individual where initially they told me they don't collect any cannabis data. And it was you know, frustrating to hear that, but we might be able to get a nice slide here if we can show fatalities where cannabis was an issue, and then maybe compare that to a year or two before. So there could be something there.
Gary, is that
Um,
statute that they can only ask if it's fatality, or is that by regulation?
Well, no, I think that that's just what they choose. So here, the number 6, you know, that is in the Cannabis Regulation Act, that they didn't want patients to be unduly arrested or searched or impositioned. And so there needs to be more than just the smell of cannabis for an officer to act on that. I think the threshold's lower for alcohol, but they were quite wanted to leave that impression because they wanted to protect a patient that was just going to the dispensary and then driving home, that the smell of cannabis couldn't be the only indication to be pulled over. You know, was that wise or not? I think that data or time will tell. That might be an issue the legislature might want to readdress. Now, with regards to the data they're keeping, I just think that you know, if it's alcohol, it's easier to test for. It holds up in court. So why am I going to go and write a report about cannabis that I can't even measure impairment? It's not going to be held up in court, and they won't be held responsible for it. They're going to hyper focus on alcohol. And so I think that's why, with regards to reporting fatalities, we don't see cannabis related as much as it could be, especially with citations. But if somebody does happen to pass, then I think that it's part of the screening panel, and that's why we get cannabis if there's a fatality that occurs. I don't think they're collecting it beforehand. And then, Haley, why don't you go ahead and share that?
Yeah, just to add to your point and reiterate, basically what we were told is they have to get a warrant to get a blood sample. And so if the way to even measure, even though we don't have a per se limit here for cannabis, if they can't even get a blood sample without a warrant, then when they pull someone over for suspected DUI, if they do the breathalyzer, that shows that they were impaired. They're going to stop there because it's just too time consuming, too difficult, not super reliable to get the blood work done, because then they need a warrant and time passes and all that.
Yeah,
So
yeah, can I just quick question? So I understand that. I guess my question was, you're saying they only report on mortality, right? On fatalities. But is that because of the statute, or is that because of a practicality, because they aren't recording anything else anyhow? Or and then if the can we get data on citations, or do they just not, as you say, they're doing it for the alcohol, not for the cannabis?
Oh, I think that you're correct. It's just sort of serendipitous if we get that information based upon the fact that it's a fatality. So sort of what you said, part 2 there. With regards to citations, that is spelled out in the CRA, Cannabis Regulation Act, that is something that DPS should be collecting and actually posting on their website. However, I have yet to be able to see any of it. And Haley has been really instrumental, and we've connected with some people there, and it's been crickets. So again, part of the discussion here might simply be, where's the data? Show me the data. Or can the legislature in their wonderful wisdom help guide DPS into taking more of a concerted approach and publishing that data? That might be the crux of the whole discussion here. Because again, you know, validating data streams is I think a huge part of this initial annual report, identifying where they are non-existent and where they could be made better. And I do have to say, and again, it has to be done delicately. I do not believe DPS is doing what the Cannabis Regulation Act statute has told them to do, because I can't find the data anywhere. And I think we sort of see that it seems like such an inconvenience to even, you know, check for cannabis, that I don't believe the citations really are truly being reported. Let's hope that you know, something, a watershed happens here, and I get an email that has all this data in it. But sadly, I mean, I haven't been able to find it. And if any of you have connections, please connect with them. But again, I don't think, and I can put this section in. In fact, it would be interesting to read if you go to the Cannabis Regulation Act. I can pull it out. It's very, very detailed with regards to what DPS really should be collecting. And so, I'm not sure. Andre, did you have a comment? It looked like you might have wanted to share something.
I was just agreeing with you perfectly. Because I honestly think it's one of those things that it had not traditionally been tested, so they don't traditionally test for cannabis. So I think that they may not have been aware that they had to do it. Would be my guess, but I'm speculating. But that would, I'm imagining that's why you're hearing crickets, is they don't want to say like, you know what, we haven't been testing for this.
Yeah, and also sometimes with some of this too, when there's new reporting requirements put into legislation, but they don't create a position for it or give any sort of directive to like who ends up getting it over there, like I don't know who their data people are over there, but maybe there's just not a position for it and so nobody's taken it on, or maybe they just haven't gotten back to us. It's hard to say at this point.
Or they weren't provided with the money to do the extra testing. I mean, that's a very real possibility too.
But again, please consider, read through and put your ask down what you think that we need, what message needs to, come out of this report. And again, here the references are at the end. I think that, again, once the final edits and reviews are done, we could probably reformat it to put the references at the bottom of the page. So just understand that that's why it's in this format right now. But all these are here, and they are throughout the document as well. And so again, this is more just, discussion and ask. We probably could combine this, but I think it's good to sort of keep them a little bit different there. So Eileen, is to move on to the next section, perhaps?
I think that would be fantastic. I would think it was probably emergency department visits and outcomes.
Yeah, we sort of did already look at workplace safety, and again, we've done that. So I think we'll move on here to emergency visits. And again, this I think is amazing. I'll let Eleni maybe talk more about this.
Yeah, apologies. This is less than half a draft. I just put something in so you can see a scaffold of where I'm going with this. Yes, Hallie, we have a lot of really wonderful information from Haley that I have not actually added into the appropriate sections, but I've been writing it. I wrote the introduction, sort of bringing up the relevant areas from other states, and then I'm going to add in the really excellent data that we have from Haley on these topics. In terms of asks for this section, I don't know if this might be a good place to bring up some of the sort of dashboard dedicated epidemiologist data analysis issues that we've been talking about, or I feel like this section is pretty a little more straightforward in terms of the data we're presenting. I think I also think everything is very confounded by COVID and changes in hospital and emergency department utilization during that time period too. And so it may just be too early for us to draw a lot of conclusions based on a couple of years of the data. Haley, I don't know if you have any thoughts on any of the asks that might come from some of this data you pulled there. Eileen or Hallie, if you have any thoughts.
Yeah, I mean, I definitely, of course, will always say getting an actual dedicated epi would be amazing, but also maybe just also even some dedicated funding to run like public education campaigns, like about safe use, responsible use, because that was never really added in when it was legalized, to be able to really promote like what is safe and responsible use.
Safe use. Okay.
This is
That
Eileen.
might
I support that
dovetail
as
with-
well. Oh, sorry.
Oh, sorry. No, go ahead. that might dovetail with sort of education surrounding pregnancy and cannabis use too, is all I was going to say.
I love it. I love it. And I think, again, that gets to the point about us in the beginning and also at the end, referring back to that all of these issues, they're nearly all related to each other. And it's about having a comprehensive evidence-informed strategy that acknowledges harm reduction and that the science is evolving. And I think that that's the humility, right? It wasn't a long time ago that there were people recommending in maternal and fetal medicine clinics that people try cannabis for their nausea, like doctors in Albuquerque, right? Who take care of high risk people. So yeah, I think that this is wonderful. I'm going to mute myself.
So again, so just to compare where we are on our annual report here. So section 1, section 2, I think we, yeah, Alan Matthew, thank you. I think that this can now be, and actually Eileen and Hallie we're already doing this with regards to editing and reviewing it. So I think we're hitting our target pretty close here. And also here in workplace safety as well. I think it's ready for review. And Eileen and Hallie, if you want to continue reviewing the workplace safety document as well. And then, of course, there'll be time for feedback going on. And thanks to Eleni, I think we're very much, in good form right here for ER visits. And
Don't read it
Haley as well.
yet.
Thank you for the,
let me
Well-
add the rest of the stuff in. Yeah.
well, yeah, and it's only the 16th. So again, and again, we're looking at perhaps a peer review August 2nd. So, we're a little ahead there. I think that the fine tuning will come as we have our comments from our editors as well. So the next section then would be sort of section 5. I'll go to that. And this is such a nebulous topic, really. Educational needs for adults and kids. Well, gosh, yeah, where do you stop? But again, this is where I pulled this from the CPPC. And again, it's a little off topic, but it is New Mexico data that could be perhaps used. But I think the theme here is if you look at medical patients versus recreational or non-patients, the topics that are brought up, if they actually have a medical provider guiding them in their use. And I think that this is one reason perhaps why our Center for Medical Cannabis exists, is that if you can see the dramatic difference between the education that a patient gets with having a provider as opposed to just ferreting out themselves. And I think that's pretty representative of that. So, but again, what an adult needs versus a child needs are very, very different. If we go back to the brainstorm, there are some articles there that sort of separates it out. Maybe the child is what gets discussed in the school. I haven't, Ann Jeter would be the contact to talk to about a cannabis module. From others I've spoken to, I don't believe one necessarily exists at this point, but that definitely could be something that kids could utilize from. And then educating the adults, again, somebody's already asking, which is great. And I think that the ask can maybe direct or guide what it is that we put in this section here. And I just saw the lockbox there. The lockbox could go into definitely this section or even the child access, I'm sure it could be threaded through lots of these themes and topics. And that's a doable thing given that I think that DOH partnered, or the state partnered with the emergency departments, and that's how they got the gun locks out. And again, that could be something to discuss. But again, so if you are on this group and you have ideas, or even if you're not, and again, I think that creating the small groups, that was just sort of a way to get things up and running so that nobody had too much on their plate. But if you feel some advocacy here, I think that I would say feel free to start sharing or some writing some things down. If I go back here, if you go here, there's some really wonderful articles. And again, Hallie, these are probably not in Zotero. I think that probably I need to do some reverse dragging, but all these right here, and this right here is a program out of California that Stanford, I think, is putting on because they want to, again,
Are you pointing to something that you, because I don't see a
it's
ship.
the Youth Cannabis Prevention Initiative. So that is a program, and they have a bunch of different handouts. And again, I think that they're piloting it in California. Stanford is behind it. That's simply there to if you have an opportunity to sort of look what they might be recommending. But these are all articles that do address education attitudes toward cannabis and then the consequences of legalization and the pediatric concerns. I think that those are all great resources that could make their way into this section.
I guess what I'm asking is you're pointing to something right here and right there, but I don't see anything.
It doesn't show up. I'm sorry.
You're not sharing your screen, Gary.
Oh,
Yeah.
I'm not. Oh gosh. I haven't been doing that. Sorry. I've been I went
It's
to the whole date
logistical.
thing. I was showing you the date line. So here we go. So again, this is sort of the brainstorm. These are some articles here.
It's still not showing. There we go. I think, hold on.
I like my
Bingo.
old computer better.
All right.
Okay, so this is these are just articles here, but again, the important part is and I guess you all were perhaps looking at me. This is what I was talking about with regards to the chart from the CPPC. That we might be a way to find to include these in some of these themes and topics. So let me go back here. And I'm sorry, this is what I was referring to. I guess I wasn't sharing as I was just blabbing off into the distance, but here we have 716, we're ready, we're here, we're reviewing this right now. Workplace safety, I think, we definitely have a document that can start being reviewed. And then we can, incorporate that feedback coming up this first part of October. And this is where I was saying, Eleni, you're ahead of, you're amazing. Here we're, really our goal was to have something done by 7/26. We're ahead of that. And I think that, getting to 8.2 for a peer review is doable, as long as we keep the inertia going. And again, we're anybody on this group, or if you want to participate, feel free to add consumer safety. Let me go to that section. I think we talked a little bit about it. I know that Eleni, you had done a lot of brainstorming with regards to this, and you had mentioned potencies as being an issue here. And this talks about the lock boxes.
Oh,
So-
nice. Okay.
So this was from that CPP study where, talking about consumer safety. Again, here you see a discrepancy or a difference between medical patients and non-patients, where the medical patients were more apt to lock things up, as opposed to just sort of hidden from view. And it's almost interesting if you added these two together and then added those two together, we probably get the same numbers. There was also a graph that talked about if kids were in the home and how this changed. So, and there again, the ask is lock boxes. So, and potency, I think, can be a theme for this section as well with regards to, consumer safety.
Gary, if you pull up the brainstorm document, I actually have a bunch of notes. I was trying to work on a draft of this, but it was too messy. It's too long and too messy to put in here. But
Fantastic. You're right. Here it is. I had seen this before too. So as you can see, we have, a good opening right here. There it is, potency, contaminants, and packaging. So phenomenal. I think we're doing well there.
Another data piece that I'm not sure if it was in the most recent CPPC survey, but it was in the last one, was on potency. They calculated the average potency for use based on their survey participants, and which was, I think, over 100 in almost every type of cannabis compared to like the recommended standard dose of 5. And so I thought that that was a really valuable piece of information for the potency section. I was planning on including that, even if it's not in the most recent report, because I thought that was really interesting.
Cheers. Yeah, CB survey data on consumer perceptions of labeling. I think, yeah, and the other thing too was the number that do it in front, use it with kids in the home. I think it was greater than 50%. I think that could make its way into this as well.
Yeah, I think that's really interesting. There's prior literature has shown that most accidental child exposures occur in the home. And so I think that supports lock boxes or the safe storage medication lock bags that we were talking about. Andrea, question, you had said at one point that we might be able to pull the data from the state or even from the private testing facilities because they're still using is the phrase bioessence that the health department's kind of tracking information in terms of contaminants and potency for the testing that's being done on products. Would we be able to do that? Do we know if there's a way to do that?
I actually have them working on trying to get together a report. So what is it exactly? They should create a report for us using SQL. We just need to tell them exactly what we want. So are you looking for, I know we want to see testing failures. So
I think testing, yeah, testing failures. I think that potency, if they're doing any potency testing, would be very interesting too.
So do you just want the average potency or?
I think, and anyone else feel free to chime in, but I think that the average potency in different products, like average potency for edibles, average potency for plant, and then for some of the higher concentrated substances.
Anything else? And I can follow up with you all, but yeah, they have data, and I just need to tell them what we're looking for, and then they just go in there and do the magic.
Okay. And when you say testing failures, I assume they fail based on contaminants for the most part.
Correct. Yes. Yeah.
Okay. Yeah, I think sort of those two pieces of information would be really valuable for the initial report.
Okay. Yeah,
Thank you.
We can get that done.
Thank you.
Going on to number 7, then percentage of calls. I think that you, I think Katie, you had started writing this section, I believe, and I think that we got this data from Haley. Again, I think you had it formatted much more pretty, but we do have some data here. But I think the great ask for this section would be to fund a poison control dashboard. I think we've sort of highlighted on that before. This is, Haley, you provided this graph, I believe, correct? That's in one of those data sets. And so, and those are, it says data sets by Haley, I think on the SharePoint. You'll find the data there, and that's where this came from. But yeah, I think we have a start here, and I think this one is heavily data driven. And I think if we just this might be really the crux of it right here. And of course, this is where we're getting our data from. And then if we go to number 8, this one is the most nebulous one of all, but I do think that the CPPC, so this I lifted from the CPPC data because what they did is they were asking questions about how did the use of cannabis change your alcohol use or even your tobacco use. So again, I think the goal was sort of a harm reduction type of a mindset. But again, we also want to make sure, especially in the alcohol using patient, that they're not going cold turkey, that they're not getting the wrong perception that, oh yeah, I'm just going to cut off alcohol and start, using some gummies at night, and that's going to be a safe transition. So that could be definitely something to stress, even though there's initially some positive results here, that you've got some people that are definitely using perhaps less alcohol if they're utilizing cannabis. But then my follow-up question to that was, is it an economic issue? They already spent the money on they spent so much money on cannabis that they can't afford as much alcohol, and that's really what we're seeing here. It's just that they're purchasing less because they've hit their purchase limit of the two together. So, but again, I know that this slide's gonna be seen as being very, very positive. We just might want to asterisk it by, we always recommend that this be done with a provider helping the patient. And then I think tobacco showed a similar sign. And again, these were just simply survey questions, but it sort of does hit that about, the impact. I mean, I haven't seen other studies that really are able to measure the impact of cannabis use on all those other things, but this might get there for us. And so, again, this is from the newer CPPC model. I'm not sure if anybody else has other comments or asks per se. Okay. Did
Gary,
we want
forgive
to look?
me. Oh, so sorry. This is Eileen. I unintentionally was like raising and then lowering my hand a whole bunch of times there. I
Oh.
don't know what I was doing wrong. Thank you so much. I was hoping I could just say a moment to something that you and I had spoken about for the rest of the team, which is that I think this is a real opportunity to help level set with the reader that cannabis, although someone can try cannabis for to help them cut back on the use of other substances, that in the case of opioid use disorder, there are two other drugs that we know reduce the risk of death. And we know that there are existing barriers to people getting them. So, and we want to reinforce that as much as possible, because there are widely accepted best practices that our legislature has and our state have not yet adopted here, in that case related to access to particularly Suboxone. And so I think this is an opportunity to frame that if people are using cannabis to try to decrease their use of opioids, then it really is about an issue to access to what is actually evidence-based care. I feel similarly about alcohol. We do know that our state hasn't, this is further afield, but that we haven't raised our alcohol excise tax, I think in 30 years, and it's among the lowest in the country. And it is, it's actually a progressive tax, not a regressive tax. And specifically, it is one that people who are more money and who are white are more likely to drink, but the people who are bearing the burden of our low alcohol taxes are people who are brown. So I'll ask us to really try to keep in mind that this presents a great opportunity to help level set on what a lot of state legislatures thought 10 years ago when data came out showing that states that had legalized cannabis had fewer overdose deaths. Even the authors of that study said that to exercise caution in interpreting it, and yet a lot of the states ran toward, in their desperation, toward legalizing cannabis, thinking that it would take care of their problem. But of course, it's more complicated than that, especially in the fentanyl era. So I think that presents a wonderful opportunity for us to try to reinforce that message that there are, that this is a sign for people don't have access to the care that they actually deserve. I'm going to get off that soapbox right now and mute myself.
So I just added that, access to evidence-based medications for opioid use disorder, and then increasing the alcohol taxes asked in that section. So again, a springboard for discussion and for writing that section. So yeah, I'm not sharing the screen anymore, but that's that's where we're at. I think that we are making progress, and I'm, that's all I have to share. I mean, Eileen, I'll pass the time back to you really at this point with regards to, do we want to do journal articles? Did we find this to be useful? How do we want to maybe, approach our next meeting to get a lot out of it? And then, of course, scheduling that next meeting.
Yeah, thank you. Really ambitious agenda for 3 minutes left. So first, I want everybody to just know that you just did amazing work here and leading up to this, and I hope that you feel great about it. I'm going to ask that if you would indicate a thumbs up, if you are okay with if maybe we hold off in the journal article, because we're having really pithy meetings right now and we're really time sensitive. So I see heads nodding, thumbs up. We're going to hold off on that. Thank you. I'm going to ask if there's any right now, and I know I'm going to come back to Hallie. But if there's any other pressing items from the committee at this time that will inform our next meeting. And I'm going to just count, you may not remember, but I try to count to 7 to myself to give people time. Okay, thank you. So not seeing any, it looks like I'm going to ask for permission that a lot of our next meeting will be structured on what we did this time. Okay, excellent, thank you. And then before we come, maybe, Hallie, what's next from you before we go to next steps?
I just have a quick question. Will there be somebody from the department who can go through and format everything and edit it so that it's all consistent? I mean, the people who are putting the word or doing the word work here, the hard work, it's great, but there's slight differences in format and all of that. So.
Either Gary or Andrea, would either of you unmute yourselves just to speak about so people can understand if that is like moving a period and a comma here and there, or how much we expect to see?
So yeah, we do plan on definitely, we'll make it a consistent format, make sure, formatted everything is consistent. If there's gonna be any major changes, like, because after we review it, we have to send it on to our comms team and the secretary's office, governor's office. So they may choose to edit some of the content at that point. But yeah, we don't anticipate there being a lot of editing to the actual content or messages. But some of it may be out of our control, but we will take care of getting it all formatted. So it looks like one consistent document that has the right formatting. And I really apologize, folks. I have another meeting that I'm the secretary for, so it's start till I get there. So I could hold hostage as well, but.
Thanks, Andre. And yeah, I can attest. When we've used the comms team before, they do amazing work. When we've done all of our educational materials, they're the ones that take the hard data or the information, and then they have created those handouts. And if you've been to our website and looked at those, they do a pretty amazing job. And so they will have the bandwidth and wherewithal to make this look like a consistent document. I'm not sure how much they'll play around with the colors and the graphs themselves, but they'll definitely be able at least to format it in such a way that it flows and it looks more like a cohesive document than just 8 different voices per se. So we do have that benefit here. Of course, if we can do as much cleanup up front as possible, that's going to be more beneficial. And I myself will, do my best to do some of that before it actually has to go to the comms team. But yeah, we will have somebody that's more adept at all of those editing, programming issues and notes than I ever claimed to be, that will help us with that.
That's great. So I have one other question. Is it possible once folks, whoever's working on any particular document thinks they have it pretty well structured, they could let Eileen and me know so that we can go right ahead and take a look at it from an editing and thought perspective, and we can jump on it right away. That would be helpful. And the other thing is we have a lot of things here that are number one written document, et cetera. Maybe if we could reorganize this so that we could find things a little more easily, that would be helpful. And then finally, I think we ought to have a meeting between Gary, Eileen, perhaps Andrea and myself after the structures are in and we've done our first peer reviewing, to go ahead and ask some of these other questions that may be legally or otherwise defined.
No, I agree. And again, I think that we'll probably have a little bit of back and forth between the groups. I think that we did sort of want to incorporate feedback to, the individuals that wrote the sections after you've had your chance to edit, to incorporate some of that. And I think that we can definitely set that up. So I think that for today, if you and Eileen would like to start looking at section 2 and section 3, and then maybe, after the first bit of August, section 4 may be, ready for review at that point. But I think that 2 and 3 can be reviewed at this point. Oh, next meeting.
That sounds great. Yeah. So next meeting, so team, we got a lot done and there still is work to do. Before, I know that Andrea was the one who had recommended before that we did a 1 month instead of our 2 month cadence. Gary, may I ask, how do you feel like we're doing if we should say meet, I'm going to throw out there August 13th, or if we should go back to 2 months? I feel like we're on a really nice roll with 1 month, and 1 month can be great for accountability. I'm going to ask people, maybe Gary, what, broadly speaking, do you think 1 month?
I think 1 month is a better choice at this point.
I will be there either way.
Thank you.
So, yeah. And
Okay.
again, I will reach out to those. There were some people that didn't make it today, obviously, and I'll make sure Katie, is able to know the date as well. If that's a good cadence for people, then Haley, do you think we'll have any more interesting data, perhaps, that might percolate through by then? I think the month gives us the option to keep tabs on the data flow. Maybe if I do get somebody from DPS to actually respond, it could really change the trajectory of a section. So I have no issues or problems with that.
Yeah, and I just got the 2023 hospitalization data, so I'm hoping to add that on before the data only went through 2022. So that is something I'm going to be working on in the next couple weeks, so that we'll have that extra year data, which I think is always helpful being so recently legal. And then the YRS data, the 2023 data, they're still working on basically making sure that the file is like fully ready to give out to people to analyze and stuff. Last I heard, but that would be really helpful if we can get that 2023 data in, because it sort of gives us a year that's less weird in the data of 2021 and COVID and all that. Plus, we added some specific cannabis questions to the 2023 high school survey, including like where they got their cannabis and method of use, I believe, are the 2 questions we added. So that could end up being some really useful information. I just don't know exactly when we'll get it at this point.
Thank you. So it sounds like with all of that, I think that 1 month would be great. And that knowing that if we end up not using we're going to use some of the meeting slot, and even if we don't use the entire hour and a half, because we don't have all of that, there still is, I think, good work to be done. So may I suggest to people August 13th, also at 1 in the afternoon?
I hate to everybody's got their own schedule, but that would be difficult for me. If the day before would be fine, or the day after, or even potentially the 15th. But
okay. So maybe we'll go in a stepwise fashion, which is I will ask if you would put a thumbs up if the day of the 14th is better for you, and if that will work for you. Okay, so Lenny's also a yes. Gary, for you also? Okay, thank you. And then I'll ask, would also 1 o'clock work for you on the 14th?
possible to do it earlier or not?
Earlier, I know would be harder for me. Sorry.
Okay.
Is that okay?
We'll work it out.
Thank you. Thank you. Okay, wonderful. So we have our date. We're also going to hold up on a journal club. We're going to follow up on probably a pretty similar agenda and similar work, but taking it even to the next level. And I hope that everybody knows that they have done amazing work. And yet we're going to ask you for even more amazing work as we keep on going, as you are finding yourself reviewing the information that we have, maybe as you're seeing journal articles come, or maybe things in the newspaper, even just you're continuing to percolate what you heard today, including the amazing presentations. And I welcome you to continue to add your thoughts to that SharePoint. The link is in the chat. And maybe when we send may I ask for the DOH team, if when we send the save the date and the calendar invitation, if we can include maybe the SharePoint link just to make sure everybody has it.
Sure.
Okay, I appreciate that. Okay, well, I will then adjourn the meeting. I hope that everybody has the rest of the week that they deserve.
Thank you, Eileen.
Thank you.